Good evening. Good evening, everyone. It's a real pleasure to have everybody here this afternoon. It's a beautiful day here in Statesboro, Georgia. Ils font une belle journée de sabbat. Et nous contents que nous tous qui là, nous venons rejoindre nous pour nous parler de un bagage qui a un rapport avec filles, femmes, en femmes mûres. Menopause. Gen yon paket tabou de menopause, gen moun ki panse se yon peryode kote fi fini, e ke gen moun ki it's scary at times for many. Mais jodi an nou val gen tout lumière sur menopause. Moi, je n'en sais rien, mais nous avons un professionnel, Janikah Brice, qui, she's a PA, a physician assistant, and she will shed some lights for us on what is menopause, what to expect of menopause, what solutions, if any, that we can have when we're going through menopause. So, juste avant que nous commencions nous by céder micro à Janikah, let's have a word of prayer. Father, our Father, who are in heaven, we come to you this afternoon with a heart filled with gratitude. Et nous venons après-midi là pour nous, en tant que petit tout, continuer à apprendre de ou-même, de petit tout à eux-mêmes pour ba intelligence. Merci que ou ban nos possibilités ça, nous demander pour le moment qui va le passer là, c'est des moments d'apprentissage, c'est des moments que nous, pour nous connaître plus de quoi nous, qui solutions qui gagnent et puis pour nous servir au mieux. Nous prions comme ça, c'est pas que nous gagnons mérite, ni que nous bons, mais nous prions au nom de Jésus qui est venu mourir pour nous sur le bois du calvaire. Amen. Amen. So, merci à nous tous qui rejoignent nous une fois de plus. Juste pour nous commencer, nous fait nous dire nous que nous comptons que nous ensemble avec nous. Ben, nous plus ou moins comment ça va le passer, moun qui pas trop habitué. Nous avons Janikah qui pourra faire une présentation pour nous-mêmes. Prends note. Si nous avons des questions, nous poser à la fin et que nous fait si demain nous ou bien pour nous faire connaître que nous là pour nous poser des questions. Et puis Janikah graciously will answer to all of our questions or most of our questions. Sans plus tarder, nous passons au micro à Janikah. Bienvenue et merci pour disponibilité.
Non.
Janikah, tu as la parole.
All right. Hello, everyone. My name is Janikah Brice. As mentioned, I'm a physician assistant. I am currently working in the urgent care. I graduated PA school about, it's going to be about a year. So I'm in my first year of working, and I'm currently starting off in the urgent care setting. But a passion of mine has always been women's health, and that's part of why I chose today's topic. I hope to eventually transition into working in women's health. And I feel like it's something, the topic of menopause specifically is something that is one that I've always been very interested in the moment I learned about it in school. And that's part of why, again, why I chose to speak about it today. So I know you might be looking at me and wondering why a young lady like me is speaking on a topic like menopause. And the reason why is I wonder if you knew, maybe, I wonder, a couple questions for you guys. Did you know what menopause was before you went into the stages of menopause? One. If you did or didn't, do you wish you knew more before entering that stage of menopause? Those are some of the questions I kind of wondered when I was learning about menopause in my schooling. And it made me realize, oh, I'm glad I'm actually having opportunity to learn about this because this is not a topic that I've heard women talk about openly. So it's something that I feel like it's important and relates. All women are, every woman is going to go through menopause eventually. So I think it's important to start the conversation at any point, whether you're experiencing it now, whether you experienced it in the past, or whether you're going to experience it in the future. So that is why I chose the topic menopause, and that is what we're going to be navigating today. We're going to talk about symptoms, solutions, and support. And I put a lot of emphasis in this presentation about natural options, things you can do at home to help with the symptoms of menopause. All right. So, what is menopause? Let's start off by defining it. Menopause is a natural physiological process that marks the end of a woman's reproductive years. When a woman permanently stops having menstrual periods, she has reached a stage of life called menopause. This occurs specifically when your ovaries stop producing eggs and the levels of estrogen and progesterone in your body decline. So here's a picture of the female reproductive organs. The ovaries are here on both sides, and every month, typically, your ovaries release an egg that goes down the fallopian tubes all the way down into your uterus and usually implants here. Here is the space where either your period, the lining sheds here monthly, and you have your monthly menstrual period, blood expels through here, going leading to the vagina, or here is where the egg is awaits a sperm that again enters through the vagina, and here is where fertilization happens. So either a baby can grow here, or if a sperm does not meet the egg in the uterus, the lining of the uterus sheds, and that is when you have your monthly period. So when you're in menopause or through the stages of menopause, the ovaries are no longer producing that egg that's traveling down the tube, creating a space for fertilization to happen, where pregnancy would happen, or where again your period would happen, the lining of the uterus shedding, leading to your period. Another major thing that's happening during menopause is this is showing the chart showing age. As women are getting older, naturally the levels of estrogen and progesterone decline. And when you reach menopause, that's when you have the sharpest dip. And it continues to go down throughout the years. And we're going to talk about some of the effects of low estrogen and progesterone in your body and why that's important. More on menopause. So the average age for a woman to reach menopause is 51, but it can actually happen as early as your 30s, and it can happen past your 50s for a lot of women as well. Black women more specifically tend to reach menopause at an earlier age. It's about 8.5 months earlier than white women. So that puts us between the ages of 45 to 55 for when we typically experience menopause. A big sign of indicator of when a woman's going to have menopause is women typically have menopause at about the same age that her mother did. Other things that can kind of change when a woman's going to have menopause is if a woman smokes or is underweight, she's more likely to have an earlier menopause, while a woman who is overweight is likely to have a later menopause. So, three stages of menopause. There's perimenopause, which is the beginning stages of when you notice things in your body is starting to be more irregular, like your periods are starting to be irregular. You're starting to have hormonal changes. You're going to start experiencing symptoms of menopause, like you might still have hot flash. You might still have your period, for example, but you're experiencing hot flashes. This is perimenopause, and then it eventually progresses to the stage of menopause, which is a full-blown 12 months period of a woman no longer having her period. If you ever go to the doctor and you notice like you're beginning to have symptoms, they won't diagnose you or consider you in full menopause. Even if you're even 6 months or 11 months of not having your period, they have to wait until a full 12 months of you not having a period before they diagnose you with full menopause. And then post-menopause is the stages just thereafter when your body is just adjusting to no longer being in this transition. So now we're going to talk about some of the symptoms of menopause. So there's a lot here, and I'm going to go further in depth. I'm going to just list these ones out, but we're going to go further in depth about some of them and talk about some solutions we got for them. So with menopause, there's irregular periods. There's vaginal dryness. Hot flashes is the biggest one. Sore breast or tender breast, chills, night sweats, difficulty sleeping, headaches, weight gain. metabolism slowing down, which means you're not processing food as quickly as you normally would. Mood changes. Might notice that your hair is thinning and that your skin is getting drier. You might notice you might have some memory problems or a brain fog. Should I take a break at any point for any translation or should I just keep going?
Well, well, bon, how long is the presentation?
We have a couple more slides. Like I want to say maybe we're halfway through, a little less than halfway.
Okay, so now I don't know when you're talking about translation, would you want me to translate the slides, or can do you know any Creole at all that will make things easier? Or how?
I don't think my Creole is strong enough.
Okay.
Yeah. Um, yeah. I will, I think this is like something that's important maybe to translate. Just talking about the average age of menopause is 51 years old. And usually
I'll
you,
I'll go ahead and do that.
okay.
Bon, pratiquement, nous gen Janikah fait nous connaît que à l'âge pour fille faire ménopause, c'est entre c'est 51 ans, c'est l'âge là que yo dit que monde pour faire ménopause. Pourtant, ménopause a commencé à partir de l'âge 30 ans. De 30 à 50 ans. Et il y a des gens même après 50 ans, ils ont toujours qu'à faire ménopause. Yo. Mais ça que statistique, y aurait, ouais, c'est que filles noires, yo ont tendance à faire ménopause yo plus bonheur que l'autre fille, l'autre ratio. Par exemple, 8,5% et filles noires, yo fait ménopause yo avant l'âge. Mais généralement, on ti poule que nous te kage, c'est que si nous comptons qui le maman nous te fait ménopause en tant que finnois, approximativement, c'est le même le ça que nous-mêmes tout, on a fait ménopause. Et moun qui fumait, ou bien qui ont genre maigre, yo gen tendance pour faire ménopause yo avant l'heure que moun qui pas fumer ou avec moun qui ont ti genre ou gros.
Okay. All right. So let's talk about the first and most common symptom of menopause, which is hot flashes. These typically are, it's like brief episodes where your body temperature is increased. A lot of women might have sweating with that, and it's related to decreased levels of estrogen in your body, like we mentioned earlier. So it's again when you're having an increased body temperature, some sweating, oftentimes, some people can feel like their heart is racing really fast. Some might feel lightheaded or dizzy. And some women, it's worse at night. So they wake up drenched in sweat and may have to change their sheets in bed and their clothing.
Yon nan symptôme sa ki pi courant. La ménopause, c'est juste suer que les couramment hot flashes. Côté que le soir, ou senti que ou chaud, ou fret, et que, ou pas, des fois même, c'est tout symptôme ça, c'est parce que niveau estrogène nous descend. Puisque le niveau estrogène descend, que le soir, ou senti corps ou li chaud, li fret, peut-être qu'il y en a même qui expérimentent ça. Ensuite, ou transpirer tout. Ou transpirer, et le plus souvent, c'est le soir que ça arrivait. Et ça arrivait que pendant la nuit, là, nous tellement nous senti que nous chaud, nous obligés de retirer rad, sous nous changer rad, et même retirer qu'on nous, si nous en bas de drap, retirer qu'on nous en bas de drap.
And I'm going to show you a video of a woman experiencing a hot flash. All right. So, what can we do about hot flashes? So, I'm going to give you the medical options on how we're trained in the field to treat hot flashes. And then on the next, I'm going to talk about the more natural options are probably less spoken about in the medical field. So, if you ever go to your doctor's office, they might offer you hormone therapy. In the beginning, we mentioned menopause causes decreased estrogen and progesterone. So, some medical providers will recommend replacing the estrogen and progesterone through hormonal therapy to help treat some of those symptoms like hot flashes. Other options that other could be recommended are things like antidepressants, gabapentin, which is like a nerve medication. There's this new one. I don't know if you have seen the commercial for Vioza. It's a new medication also used that specifically targets hot flashes. Other things that will be recommended is some lifestyle changes, like avoiding triggers that things you know that cause your hot flashes. If you notice you drink it, it occurs with caffeine, it occurs with alcohol, spicy foods, things like that. Avoiding those may help decrease the severity of your hot flashes, and regular exercising. So, listing it here just so you know, but the other options, like we talked about, the herbal and supplemental options. So, I highlighted in yellow some of the ones that you're going to see repeated throughout the presentation a couple times. So, for herbs, a common herb that's found to help hot flashes is black cohosh. And research shows it specifically targets the estrogen levels, which helps with the hot flashes. There's red clover. There's this Chinese traditional herb called dong quao. And there's maca root. There's sage. Um, these things, again, help target hot flashes. The other thing, supplements, which is just also, and in red, I listed some of the foods that you can eat that will also help with some of these with the hot flashes. So soy products with soy like tofu, soy milk, soy sauce are found to have some estrogen, plant-based estrogen, which is great. Vitamin E oil, you can take the supplement of vitamin E oil available over the counter, or you can have foods like avocados, sunflower seeds, walnuts. I'm not going to run through everything here. What I instead want to do is just provide you guys with the presentation after, just in case you want to start trying some of these at home and see if it helps rather than taking the medication options. Some other things are magnesium. Magnesium doesn't just help with hot flashes, it helps with overall relaxation, sleeps, it also helps with regular bowel movements if you ever have struggle with constipation, anything like that, which is also another side effect that can happen with menopause. So, foods with magnesium include soy products, again, red meat, nuts.
Janikah, no. Jocelyn,
Jocelyne, est-ce qu'on peut fermer le micro là, s'il
okay,
te plaît?
yeah, she just did.
Okay. Some other things that we've heard here a lot about is omega-3 fatty acids, and that can be found in fish oil. I have heard that in Haiti growing up. I think it was my mom who told me you drink fish oil straight, no, not even in the tablet like here. You just drink fish oil, and that has a lot of omega-3 fatty acids, which is something that can also help menopause. B vitamins, great for hormone balance, mood, energy. And again, some foods listed there that have these included. So next, vaginal atrophy. Vaginal atrophy is another big one. I feel like this is something that, from what I've seen, like just through my learning experience and my rotations, I see it does change the quality of a life for a lot of women. So vaginal atrophy is when the vaginal skin, here is what it looks like with a younger. I don't want to say healthy because I still think both are healthy. I want to just clarify. This is what happens with when the lining of the uterus thins, as you can see on this side. It thins and it gets drier, and this happens to the vagina, the uterus, even the urethra, which is where you pee from. So this leads to a lot of other health difficulties. So with vaginal dryness, you might notice with vaginal atrophy, you might notice that you're experiencing dryness, burning, itching, pain with intercourse, going to the bathroom more often than normal, more than usual, and when you have to go, it's like, I gotta go right now. And overall, your vagina is less elastic. And that's again because of that drying and thinning of the tissues. And before we move on, did you actually, is it okay if you translate? I'm gonna go back to a little bit. I don't know if there was anything you can translate here.
For the vaginal atrophy, this part?
Yes.
OK. Yon symptôme que nous gagnons, le nan la passé trop ménopause, c'est vagina là qui atrophié. Ça veut dire que gagne un dehors tissu, un dehors de vagin, urètre là, qui affecté des fois la partie vagin li kon sèche, nou ka gen des brûlures, le na fait bagay, li ka fait mal, et ça kon rive côté que nous sorti dans vie al pipi souvent. Et puis, ça, une raison te kou vagin li perdu l'élasticité. Si nous regardons dans photo qui devant dans la partie gauche là, c'est lui-même qui, bon, expert là dit pas dit le normal, mais ça c'est côté li pas atrophié, et la partie droite là, c'est lui-même côté nous que li ont li moins rose, li pâle, et puis c'est partie sa côté que lui montrer que photo que vagin vient atrophié.
Okay. And then just to go into that, the vaginal atrophy and just the thinning, drying of the skin overall leads to a lot of issues. And some of this can be increased, like we talked about, pain with intercourse, vaginal infections. You might have a yeast infection or something called bacteria vaginosis, where bacteria more easily gets into the vagina because it's less lubricated. And then just overall increased risk for UTIs, which is urinary tract infection. So we're gonna go in depth and just keep talking about some of these changes down here, which you mentioned, and what can we do about vaginal atrophy? So vaginal atrophy, what you can do is there's some over-the-counter lubricants that you can use. You can use moisturizers that are also available over the counter, and you just pass it inside vaginally. And if it provides relief or comfort, that's one option. You can talk to your doctor about a vaginal estrogen. Again, in the video beginning of the presentation, you mentioned menopause is a lot of the symptoms are due to lower estrogen. So the thinning of your vaginal skin is actually because you're having less estrogen going to the skin of your vagina. So if you get a prescription for vaginal, it's like a gel, estrogen, and you just insert it probably nightly or however long you're prescribed it, it pretty much just kind of helps the vagina go back to being more lubricated, more just kind of just helps reverse some of the effects of menopause. There's other things you can talk about. There's more other oral medication options you can talk to your provider about, and there's even a laser therapy that some women like to pay for, and it's called Mona Lisa, and it pretty much just removes the old lining of your vagina with the laser, and then it grows back new and lubricated, elastic layer of vagina. It's honestly an interesting option if anyone decides they ever want to look into that. And then on the next slide, we're going to talk about some herbal options. So another one, just to skip to the last one, I know we mentioned vaginal lubricants like estrogen. Something you can actually use is aloe. Aloe vera is a good option to insert vaginally. It provides comfort, lubrication, also just helps with the tissues. Or you could also eat it orally. So that's another good natural option. Black cohosh, like we mentioned before, red clover, the Chinese herb dong quao is another option for vaginal atrophy. And these are things you take orally. And then other things like you mentioned, I know I mentioned some of the foods that they're in, omega-3 fatty acids, which is the fishy things like salmon, fish oils, vitamin E, collagen, um, and then probiotics. Probiotics are available over the counter. All of these are actually available over the counter at any CVS, any pharmacy. So these are some options you can use to help with the vaginal atrophy. And another thing which is this one I actually believe is probably this one really changes hinders this one plays a big part in women's livelihood, and this one is urinary incontinence. This is when it's difficult to pee, I mean, to hold your urine. This is when you're going to the bathroom more often than usual. You're accidentally wetting yourself. It happens to your cough. You're leaking with coughing and sneezing. So this all has to do with the same thing we talked about, the normal pelvic floor before menopause, and then after menopause, things atrophy. So the skin gets weaker and the muscles and the skin overall gets weaker and drier. So this is the pelvic floor, which holds up your organs like your bladder, your uterus, your rectum. And this is where this is menopause, where the muscle weakens, and because it weakens, your bladder kind of weakens as well. Urine starts leaking out the bladder. We talked about the changes with your vagina. The skin starts thinning, and then also the rectum. So, like we mentioned, it's the involuntary urinary leakage, not being able to make it to the bathroom. And then we're also going to talk about we also talk about pelvic prolapse, where the muscles just kind of weaken. Okay. Do we want a translation for this before I move on to the next slide?
Yon nan symptôme ménopause, c'est incontinence urinaire. Ça qui liye se ke involontairement nou ka gen pipi pipi kap tombe sou nou et que nous ka le nou tousse, le nou éternuer ou bien si n'a pris fort on ti bail qui sorti ou du moins le pipi en kembe nou an, c'est même moment le kembe nou pour nous courir aller sinon n'a font ti pipi sou nou. So, c'est parti incontinence urinaire qui gagne parce que gagne nous gagne pas l'organe nou yo qui baka ouais trop bien nous gagne bladder nous gagne urètre nous gagne tube yo qui fin anti jan même la partie le rectum là qui anti jan vinn pi fin I mean qui pi fin qui fait que nous des fois le bagage ça va faire la tousser bagage ça que nous pas ka kembe pipi vraiment li couler.
Yes. And another part to this pelvic prolapse that I forgot to mention is some women might have experienced this after childbirth or around the time of menopause, where some of your organs, like we mentioned, the bladder, uterus, rectum, can actually protrude out of the vagina. So you might notice, like, if you pass your hand inside, you might feel something soft there that wasn't there before, and it could be your bladder is poking into your vagina because of this weakened pelvic floor. It could be your uterus has kind of poked down a little lower, so it's causing you to feel a sensation of you're not fully emptying. You might feel different. There's a lot of sensations women can feel, but you feel like a pressure there. And this again happens with after a lot of women have had a lot of children, and for some women it can happen after menopause. And we'll keep talking about that on the next slide event or later on in the presentation.
Okay.
Oh, go ahead.
Yon nan bagay ki important ke mwen bliye mensyone, se ke moun ki fe timoun, apre padan ya fe akouchman, ou bien moun ki fe apil timoun, de fwa yo ka remarke ke si padan ya pase men yo, ka gon on pati, an dedan ki an ti jan mou, que peut-être nous pas de café ou manque là avant. C'est l'en fait si mon nan et que nous gain urètre là avec utérus là qui juste quand ils gens descendent qui viennent tomber sur partie qui plus proche de vagin et c'est lui même que nous sorti. N'a parlé de ça la prochaine en présentation que notre slide qui vient après.
So, what can we do about urinary incontinence? There are some medications that you can take for it. And first, I will say, like, while I'm emphasizing natural options to of things you can do for medical treatment, there are some things that I would recommend, like if it's really affecting your quality of life, absolutely consider reaching out to your medical provider and getting medications for it. Because something like urinary incontinence, that can really affect you day to day. It's something that could really have you really uncomfortable, feeling like you can't go everywhere. You have to think twice about what you're doing. It could just really overall affect your quality of life. So if this is something that you feel like is bothering you and you can relate to this, I'm going to just list some medications for you to consider talking to your doctor about, and then some other more information on like natural options you can do as well. So for medications that you can take for urinary incontinence, something called anticholinergics. An example of that is like allergy medicine, like Benadryl. It has a side effect of drying up extra fluids. So oxybutynin, myrbetriq, these are all things where they kind of dry up extra fluid to kind of just help your bladder not leak urine so often. Other things that are recommended, which I pictured here, are pelvic floor exercises. It's things you can do to strengthen your muscle here, your pelvic floor muscle. Pessaries, which is a picture here. It is like a small rubber device that they insert vaginally, and this actually can help with the vaginal prolapse, like we talked about. In this picture, you can see the uterus is slightly entering into the vagina. It's kind of gone down lower, so a pessary kind of helps push that back into place. It's like I said, a little piece of rubber that pushes your organs back into place. It helps with the prolapse of your organs, and it also helps with urinary incontinence if that is the cause of some of your bladder leakage. Other things you can do are pads and panty liners. You can wear those daily to just help prevent your underwear from getting wet with the leakage. You can also do procedures, which again, I have seen women do procedures and it has really changed their quality of life after. And some of the procedures are one where it kind of holds the bladder up after some women have had babies. After pregnancy and delivery, their bladder has kind of prolapsed into their uterus, like we mentioned before. And a bladder sling it's a very quick procedure where they just they use something like something to hold the bladder up so that it's no longer protruding down into the vagina, and it helps with the urinary incontinence. Bladder Botox is another one where they would do to also a very quick procedure. They insert injections of Botox into your bladder, and with that, Botox helps stiffen the bladder so that when you really what's happening is when you need to go to the bathroom, your bladder is squeezing, telling you, I gotta go. It can't hold it. When you cough, it's squeezing. When you sneeze, it's squeezing. So what the bladder Botox does is it stiffens it so that it's not squeezing as harshly on you, and it's relieving that urge to go, and probably it's going to give you the relief so that you can hold it for a little bit longer. Other things to help with urinary incontinence are avoiding caffeine, avoiding alcohol, citrus and tomato products can help worsen it, and artificial sweeteners. I know this was a lot. If you can translate whatever you can, but if you can't, that's I understand.
Gen de twa ed ke nou ap ba nou pou nou ka ede nou avek inkontinans uriner. Premier, nou gen se medikaman. Mbliye nou medikaman, an kote diya, se
Anticholinergics like allergy medicine like Benadryl.
ok. Gen se de medikaman ke nou ap pran kouramman pou alerje te kou Benadryl, li ede parce ke pou an rezon pou an lot, Benadryl lan li absorbe likid, maron si map di sa bien, li absorbe se de likid ki ede le, par exemple, si nap tousse, et puis si nap rifo, avec puisque liquide ça li absorbé, li pa koule encore. Ensuite, nous gagnons sous le nous gagnons c'est de l'autre procédure que nous avons fait, ça que les pessaries. Pessaries sont ti un morceau caoutchouc que vous mettez qui pour pousser euh, non, utérus, non?
Any of them, any of the organs.
Oui, qui juste pousser li, rentrer pour une prendre forme ni, pour elle te supposé gagner. So, nous avons utilisé un persévérant pour ça. Ensuite, nous avons bladder sling, nous Botox. Et juste un bagage qui est plus facile que nous avons utilisé, nous avons mis un cotex ou bien un petit padio tout petit qui peut aider nous. Ensuite, éviter de boire alcool, par exemple, et puis bagay qui gen café, qui un peu caféine là-dedans, ça yo activé incontinence urinaire. Et sinon, l'autre bagay encore tout, c'est de suppléments que nous prendre en plus qu'on a fait exercice. On c'est de exercice côté qui pour raffermir tout parti interne yo ki ka fermi ke nou gen imaj yo la sou ekran, se nou ka we, nou ka ese fe yo, sa te ka ede to.
And then other some natural options for urinary incontinence. So magnesium, like we mentioned before, so it helps relax the muscles. Like remember we talked about the bladder and the pelvic floor. Sometimes you're squeezing, spasming. So things like magnesium can help relax the muscles, take some of the tension off, allow you to hold your urine more. And that examples of that is soy, legumes, seeds, almonds, brown rice, fruits like bananas, apricots, etc. Other things, vitamin D. That also helps with the muscle weakness. Collagen is another thing. And then pumpkins. The reason why I put this soup jumeau here is because pumpkin seed extract has been shown to also help with bladder control, reduce nighttime urination. And then probiotics. So these are some options of things you can try to see if it helps, kind of ease some of these symptoms. Because again, these can be some harsh symptoms for someone to deal with for the rest of their life. So I recommending anything if this is something you experience, try something and try one of these and see if it helps. And if it doesn't, of course, talk to your primary care doctor or your if you go to a gynecologist and they can get you started on some of the other options that we talked about.
Gen seri de opsyon naturel ke nou gen to, e nou men manta ka haisyen, nou toujou kon si remèd ke nou ka fe. Par exemple, nou gen magnésium, magnésium nou gen soy, légumes, gren yo, takou gren, tout not yo. Yo gen ladan, gen pitimi, du brown rice, et puis c'est des figues, et puis avec abricot, tout, c'est des manger qui riches en magnésium, vitamine D, nous ka jwenn lan saumon, sardine, aransor, foie, et puis lan tout na fiche lan œuf, avec lan mushroom nous ka jwenn ça, et puis gen seri de lot bay collagen, on bagay ke gen gren joumou, des fois nous konjwen ti gren joumou an te pou snack te kache, yo menm tou yo vin realize ke li tre bon an pil ki pou ede pou te gen anvi pou ale pipi souvan, surtout le soir. Tout sa ede, e pi gen probiotics. Nou ka pran probiotics yo menm tou yo ka ede nou.
All right, and another big symptom of menopause can often be mood changes. Some women might feel like they are just not feeling like themselves. You can feel irritable, mood swings, anxiety, depression, fatigue, brain fog, memory issues, difficulty sleeping. And these are all due to the hormonal changes that are just going on in the body during this time.
Non seulement que physiquement, ménopause affecte nous, émotionnellement tout. C'est pas faux que nous avons faux, mais des fois nous avons réalisé que nous l'on humeur, l'on moment, et puis nous juste changer, l'on saut d'humeur. Nous irriter pour des bagages qui étaient capables d'irriter nous auparavant, nous gens senti nous anxieuses, nous senti nous déprimés, fatigués, et des fois nous pas clair, l'idée nous pas claire, nous oublier, on sait de bagages, et l'autre bagage encore, nous avons des difficultés pour nous dormir. Tout ça aussi fait partie émotionnellement comment et ménopause affecte nous.
And what can we do about some of these mood swings? The one of the options or medical options are seeking therapy if you feel like you have someone you want to talk to about how you're feeling. Another option is medication if you want to talk to your provider about starting an antidepressant, again, hormone replacement therapy, and there's other medication options. Some less different approaches are like relaxation techniques, exercise, good diet, sleep, journaling, prayer. And then on the next slide, we're going to talk about some herbal and supplemental options again.
Ça nous ka fait pour ça. Nous ka parler avec docteur nous, nous ka gen thérapie, nous ka prendre médicaments antidéprimants, nous ka gen hormones, nous ka prendre bagay qui pour remplacer hormones nous te gen doit faire exercice, changer ça nous manger, j'en nous manger, dormir plus. Et puis, c'est écrit ça n'a senti sur un bout de papier ou bien on cahier, on carnet, et puis prier sur ça tout. En plus de ça, nous avons des feuilles supplément que nous allons là, l'an prochain slide là.
And then, as mentioned a couple times throughout the slide, omega fatty threes, which is the fish oils, flax seeds. This helps with mood regulation, brain health. So, salmon, herring, sardines, and many other. Magnesium, like we talked about again, really helps with good sleep quality, relaxation of your muscles. We can mention regular bowel movements. Vitamin B complexes are another good thing for energy, mood stability. Vitamin D is another good thing. And specifically vitamin D, studies are showing that Black people have tend to have much lower levels of vitamin D. So that can be a big cause to some mood symptoms that one might be experiencing, like anxiety, depression, etc. And then another option is L-theanine, which is a natural herb found in, or natural property found in green tea, which I have pictured here, helps with relaxation as well.
Ou ap gen omega 3 fatty acid ke nou jwen yo vitamine sa lan saumon, sardine, flaxseed, chia, epi pou nou lan aransa, magnésium. Nou pale de sa an pil magnésium, légumes, jen ap manje du riz, nou pa du riz blanc. Epi fig avèk aprikot, jen te di ta la vitamine B kompleks. Ensuite, vitamine D. Études yo prouvé que moun ki noir, yo pa absorbe vitamine D aussi facile. Ça veut dire qu'il est important que nous ta augmenter vitamine D que nous prenons et ça n'a pas dans saumon, arançon, sardine, l'huile fade morue, sardine, œufs avec tout bagay ça que nous prenons qui pour aider nous avec green tea que nous avons photo là que nous avons devant nous là. Et puis essayer relaxer nous sans que comprendre green tea là, nous prenons aider nous pour nous relaxer nous mieux.
All right, and we're almost done here. Other things that you can do for mood changes is the black cohosh, John's wort, and ashwagandha. And these, again, all available over the counter. And I have to give a very special shout out to ashwagandha because it's an Indian herb. It comes in tea. A lot of these come in tea forms. You can get them in supplements where you swallow the capsule. You can get them in gummies where it's just already in there. And ashwagandha is a huge one. It really, really helps with stress, anxiety, calmness. Um, and it actually has a side effect that actually can help with vaginal dryness as well. So I'm a big fan of ashwagandha. I recommend it to my patients quite often as well. And just so black cohosh and St. John's wort, like you mentioned. And again, I want to provide you guys with all of these slides after in case anybody wants to just reference them and begin trying things, trying the natural alternatives and seeing if it helps with some of the symptoms you're experiencing. So before we wrap it up too, other signs of menopause that still deserve their honorable mention that I didn't go in much depth about today, I still want to mention. So cardiac changes, so heart changes. Some people might feel like their heart is racing occasionally as a sign of during their period of menopause. Other things could be dry skin, thinning hair. Other things can be osteoporosis. Because of those decrease in estrogen and progesterone, like I mentioned earlier, your bones are actually becoming more brittle as the years go on, and they become more weak, which means it's more easily to break. So certain things, a fall might cause a broken hip in someone who is 66, where if they had that same fall, maybe when they were 40 years old, it wouldn't have had the same impact. And that's just because the bones are getting a bit thinner due to menopause. Other things are weight gain. You might notice that I mentioned earlier, your body's not metabolizing food as quickly as it did before. Other things are joint and muscle pains, body changes and odors. Some women have noticed that they have a stronger body odor, that they stronger, less pleasant body odor after menopause. Other things are more unique. Some people say they have tingling and burning of their tongue. Some people say they have ringing in their ears. There are many different symptoms of menopause. It affects so many women differently, but I just list some of these so that people could just maybe know that you're not alone if you're experiencing some of these more less spoken about symptoms as well.
L'autre symptôme de ménopause que nous gagnons, c'est changement cardiaque et nous ka wè que cheveux nous, on ti jan vin pi fin, corps nous, on ti jan, peau nous jan ti jan sec, et gen ostéoporosis, tant que Janikah a mentionné, nous te gen a pensé, on moun ki gen 40 ans, qui tombe avec on moun ki gen 60 et plus, moun 40 ans ka levé, li tombe levé, mais 60 et plus, an gen paquet de chance, pour gen zo qui casse, et ceci, c'est parce que nouveau estrogène nan diminue en pile, nan li même qui fait que li zo yo prone pour yo casser. Gen moun nou pa, le nou pren poids, nou pa perdu aussi facilement, c'est parce que nous gen, tout ça fait partie de ménopause, et ensuite nous gen qu'on fait mal, même si c'est pas parler. Qu'on fait mal, et gen des moun qui nous pensent que gen gon odeur dans koyo, qui ont ti jan pas fin trop plaisant, que vin découvrir tout ça, c'est une cause ménopause, que, qu'on rive, ensuite gen, lan yo kap un ti jan, yo senti lan yo ap gratte ou piqué yo, et puis qu'on tande bay lan zore yo, kap, comme un petit bête kap, une sensation, un petit bay kap mettre de lan zore yo, tout ça, c'est cause, symptôme ménopause que yo et tout.
Overall, menopause is a natural part of life's journey as a woman, and just you're not alone in navigating. You have a community of women around you who are going through the same thing, who either have gone through it or will go through it eventually. And I just wanted to have to bring this presentation up so it can be a conversation and to just bring more awareness to symptoms that people could be experiencing and maybe don't feel comfortable talking about, maybe feel like they didn't know that other women are experiencing, or maybe they didn't know, oh, this is related to menopause and I didn't realize. So if you have overall, and if you have any concerns or guidance and you want to discuss your menopause symptoms with either a friend, a provider, or just anybody really, any other woman, just know that people are here. You have community, and if you do choose to talk to your provider about it, make sure to go in detail with your symptoms so that they can really know what you're going through and the best way to help you.
Ménopause, son bagay ki naturel que liye, nou pa bezwen peur, parce que nous toutes, si nous pouvons arriver là-dedans, nous privé là-dedans. Et nous pas supposé passer par transition ça pour qu'on nous, qui ton esprit ouvert. Nous ka parler en communauté, et si nous gen nan wè docteur non pour quel que soit symptôme, que nous pas kon senti avant, pas senti nous gêner. Parler avec docteur nous, faire connaître ça nous senti parce que yo là pour ça, et puis nous qu'à discuter tout parce que c'est pas un bagage, c'est pas un tabou, c'est pour maladie que lié, ou bien son on plague que lié, tant que pour nous peur, faut que nous pas parler de ça parce que nous pas pour nous, dans le processus, mais nous pour ça.
All right, and these are my references.
Ouais.
Thank you guys.
All right. Thank you, thank you, thank you, thank you, Janikah. Thank you for everything. Nous, n'a pour ouvrir, floor la pour nous pour moun ki gen question. Moi-même particulièrement, moi, content que aussi jeune koye, ou gen compassion pour grand moun tan kou nou yo, ça, sont ici que les faut, et que nous content que ou prêt pour tes connaissances ou partager pour tes connaissances ensemble avec nous. Euh, Flore lan l'ouvrir pour quelque chose qui a une question, n'a va signaler ça et puis m'a pi fait Janikah connaît. Mais avant, moi j'ai deux questions. Bah connaît si m'ka poser yo. The first one, can someone get pregnant going through menopause? Is that possible? And if so, what are the risks, if any?
Yes, good question. I actually want to share my slides. 1 second. So, let me 1 second before I answer. There was something here. Here, this is the second slide. So the question of can someone get pregnant when they're having menopause? Well, let me actually go here. So there's 3 different stages of menopause. When you are perimenopausal, you can still get pregnant, and that is because when you're perimenopausal, you haven't. So let me actually back forward. I remember I mentioned earlier that doctors take very seriously the definition of menopause. It has to be a full 12 months when the woman has not had her period. And the reason that they take the 12 months very seriously is because it's kind of just based on research and trends of once your body has gone 12 full months consistently of not having a period, the chances of you being able to have a period or have a child after is greatly decreased to the point where they're defining as zero, close to zero.
Mhm.
But when you're perimenopausal, your body perimenopausal means you can be having hot flashes, you can still be having your periods, even if it's you have your periods once every 6 months, you are still not in menopause. Because if your body at any point is releasing an egg, and I'm going to show you back to this slide, if your body at any point is releasing an egg, which is your monthly menstrual period, you still have a chance of getting pregnant. So the idea of it again is every month an egg leaves your ovary, goes down to your tubes, and it waits here in the uterus for a sperm to meet it. Um, and until you're 12 months of with going out your period, you are still at risk for pregnancy. So the answer is if you are perimenopausal, you can absolutely still get pregnant. If you are menopausal or postmenopausal, no, you cannot get pregnant because the egg is no longer leaving your uterus, waiting for the sperm to implant and make a baby. And then for the risk, truthfully, I'm not too sure on the risk of if you were to get pregnant. I know that they say the risk is high. They even use this unpleasant term called geriatric pregnancy, of when you are, I want to say, past a certain age, in late 30s. When you're past that age, they say any pregnant you have is considered geriatric, which means an old pregnancy. Um, so I don't quite know the risk of, I think it differs for everybody. And I think it would take more of an individualized approach to answer that, but I don't have the expertise to answer that.
Thank you. Thank you. I
Yeah.
have more questions since there is nobody has other question. L'autre question que me posait, est-ce que généralement yo dit que pendant période menopause, so either peri or post, or even during menopause, que gen yon déclin de libido. Um,
Mhm.
Now, how is it true?
Yeah.
And if so, how do everything that we take, the supplements, so can they help out?
Yes, that's a good question. I actually wish I spoke more about that. I hinted at it a little bit here, and with the vaginal atrophy. Let me see if I can. But yes, so there is definitely absolutely a decrease in libido.
Se on loppa on gelato.
Rachel, Rachel, oh, yeah, go ahead.
Okay, for some women, there is actually an increase in libido, and for some women, there is a decrease in libido. It varies. But a lot of the decrease in libido or decreased desire to have any sexual intercourse for some women, it comes from vaginal dryness. It comes from just discomfort. So
Mhm.
they don't want to engage in any sexual intercourse because it's uncomfortable and it's painful. So I was hoping to hint at it with if you take some of the supplements that we talked about, it can help with vaginal dryness, which would then, for some people, help with libido. And then another medication that I mentioned earlier, that I actually learned about, has a side effect, is ashwagandha. Has actually a side effect of mildly increasing libido. It increases vaginal lubrication, and it also helps with mood changes. So that's another great one. I'll go all the way back to that to just show you guys how to spell it. Ashwagandha right here. This helps with stress, anxiety, has a side effect of acting as a natural lubricant, and then it also acts as increasing libido, which is something I recently learned. So another great natural alternative. Yes.
Thank you. Anybody else? Gen moun ki gen question? Si
Yes.
oui,
I have a question.
yeah.
Thank you, Janikah, for putting this together as we've I'm actually learning quite a bit. In regards to symptoms, right? You have a lot of the symptoms that comes with natural age, and some people have dryness overall, right? That's part of life. So how does one go and get tested, or how do they know which stage of menopause they're in?
Yes. For the stages of menopause, so you can to mention the testing part. You actually can get tested. Your hormone levels can get tested to see how high your estrogen and progesterone are. Um, So that is something your doctor can do, one. And two, really the only definition that they use to just say if someone is in menopause is that 12-month period. That's literally it. The 12-month period, and then your doctor, I feel like depending on I feel like more likely if you have a gynecologist, they're more likely willing to do the test for you, the hormone levels, and see where they're at and where it's falling at. And then, could you ask the other question about the dryness again?
There are some women that are naturally dried, right? It's
Mhm.
part of what is part of life for them. So how would they know that that's menopause versus, normal life?
That's a good question. I guess the hormone, if you got your hormones tested, that would be one. But I imagine if you are naturally dry, you might just naturally have a lower level of estrogen than other women, which is it's possible. So to help with that, ideally they can give you either oral, your doctor can prescribe you oral estrogen after checking your levels to see if, oh, you run a little bit low on estrogen. Let's supplement that and give you some estrogen. You can do vaginal estrogen, which is prescription only. And then over-the-counter lubricants and moisturizers, which are okay. And then, like I mentioned, a therapy that I have seen do, and I will be very honest. I think if we're being really honest here, this is a therapy called Mona Lisa that I would actually recommend for every woman if you can afford to do it and want to have like a better quality of life in terms of vaginal atrophy. You pay the price, and it's a vaginal laser where they laser the lining of your skin. They numb you so you don't feel it. You go in every couple weeks. They numb you. They do a laser on the lining of your skin, and it pretty much burns the skin off. It clears the skin, and then new skin grows. And I have had a 70-year-old patient. She said that she had the vagina of a 20-year-old after that. And the women were obsessed with it. It had a rotation in Florida. It was a retirement city. It was in a retirement town where the women were very comfortable financially, and the women just were taking care of themselves after their kids, after everything. They were retired. They were spending their money to take care of themselves. And one of the procedures that the doctor had, she offered Mona Lisa. They would do the vaginal therapy, come in about once every couple weeks, get the laser done, and I think it's a one-time thing after your sessions. They would get the laser done, and then they said that their sex life was amazing with their husband. These are women in their 60s, 70s. They were saying that they had the vagina that they had when they were 20 years old because of this procedure. So I always tell people about it because
Is
I
it covered by insurance? The Mona Lisa.
no, it's usually not. It's usually not. I mean, I can't say for sure. I know then they were paying out of pocket, but so I don't believe it's covered by insurance. So, yes, I hope that answers for the vaginal atrophy of some women are more dry, versus some women it's menopause causing it. But if you're in the perimenopausal stage and you notice the dryness is worse, it's a good chance that it's due to menopause. So, yeah. And then Separate, I know you had your hand up for a while.
Yes, thank you. Thank you, Janikah. Thank you, Astrid, pour mon travail, mesdames. Et mon content, mon content de belles informations avec une question femme nan, li gen rapport avec l'âge, comme si conversation ça yo, li li attire monde qui commence dans la quarantaine, dans la cinquantaine, etc. À quel âge? À quel âge vous pensez que une jeune fille ou bien une femme qui a supposé commencer pour gagner information ça? Est-ce qu'elle trouve bonheur pour le groupe d'âge pour connaître ce genre d'informations ça?
Hmm.
On
That's a
pas besoin de traduction, pas vrai? On comprend.
Yes. Yes, I understand.
OK.
That's a really good question. And honestly, I actually would like to ask you guys that question. Like, what age do you wish you knew what to expect? I really would like, I don't know when there's a good age to talk about menopause, and I would like to know when do you wish you knew? Did you know about it? Was there anyone who spoke to you about it? And what do you think the ideal age to learn about
Mwen
it?
ka repon. Par ayer, mwen pa konen si, mwen pa wè si gen moun ki vle pose kesyon, parce ke Mba wè li la an lan ekran mwen. So, si gon moun ki pose kesyon, go ahead parce que
Gen deux men ki te leve,
mba wè
men
yo.
peret desan, gen men Marie-Janvier ki an le.
Jusqu'à présent, mba wè yo. OK.
Nou
Um,
gen men, ou gen men Marie-Janvier ki leve.
OK. Est-ce que Marie-Jean ou vle
Si ou
ale? Ah,
departaje ekran, retire afiche lan, sa permet wè ki moun ki a pose kesyon. Retire afiche. Stop
OK.
sharing, and you'll see who's question. Okay.
OK. Good, good. Thank you. I can see it now. Yes, thank you. OK. Kite mwen Marie-Janvier ale pose kesyon, et puis apre sa nan repon nou, Janikah.
Yes, my question is, I mean, I came late. Good evening, everyone. I came late, but my question is, they were saying most of the divorces happen when women are having menopause because of mood swings. So I don't know if you have addressed mood swings during that women having mood swings during menopause. And do you think it's true what they're saying?
Yes. Give me 1 second. I'm going to put on that slide and
Janikah, you on mute. Juste un petit moment, présentatrice nous dit nous faut cette année.
all right. Sorry about that.
Mhm.
Okay, so for mood swings. So I did touch a little bit on mood swings. For some people it ranges. Some people have mild mood swings where they don't really notice any changes. Other people have severe mood changes where it's like they feel like they're a complete different person. Some of the things that women experience is like they feel more irritable. They're annoyed more easily. They notice they're going from hot to cold really quickly, as in 1 second they're okay, next second they're crying, next second they're happy and they don't know what's going on. With other things can be feeling more anxious, more worried day to day. Others can be depressed, just not feeling like you want to do anything, not motivated, you don't want to get out of bed, it's hard. Fatigue, brain fog, memory issues, forgetfulness, your mind just doesn't feel clear. Difficulty sleeping. These are some of the common mood changes associated with menopause. And I imagine that anybody who is a partner, who, if you're a wife, if you're a mother, if you're a friend, this is something, your mood changes are affecting you, but it's also affecting your daily interactions with the people around you, your coworkers maybe, but especially more so at home, and I bet especially more so with your partner. So if I don't know the statistics and the studies about how menopause and mood swings specifically affects a marriage, but I would absolutely expect them to affect the marriage, because if it's affecting you, it should be affecting your partner, because it's how you interact with your partner, it's how you interact with your kids. You might be more irritable. These things are your daily interactions with people. So I absolutely feel it's expected to affect how you are behaving with other people. But how it affects marriage specifically in the studies and the numbers, I don't have that. But just to go back onto some of the things that we mentioned to help with mood swings, I mentioned a big one that I'm a big fan of, which is ashwagandha. Helps with stress and anxiety. It helps with a lot of other things we mentioned earlier, vaginal lubrication, libido, other things, black cohosh. A lot of people, a lot of women, a lot of studies are saying St. John wort is a good option. It's something you can Google it, and the first thing you hear is women are using it for menopause and raving that it really helps with stabilizing their mood. Other things like we talked about, omega-3s, fatty acids, magnesium. These are things you can do to help if you want to try something at home. But of course, if you feel like you need something stronger, talk to your medical provider, and they can start you on antidepressants. They could start you on hormone replacement therapy, other options. These are the options of what we can do for mood changes, pretty much. And again, I'll provide these slides at the end if anybody wants to reference these, so you don't have to memorize them. I'd like to give that to you guys.
Thank you.
Merci. Nous gagnons en réponse. Monique dit que l'âge que lui souhaitait que lui te connaît de ménopause, c'est à 30 ans. Nous croyons que non, Serette, mais Serette qui te levé, Serette.
Oui, m'a dit bonsoir à tout le monde. Bon, merci Janikah, merci Astrid. Nous avons tout conseil ou bail de ménopause là. Moi-même, je ne connais pas si c'est ménopause mais que je fait. Pendant plusieurs fois que ça a plus que 6 mois de cela, moi, chaque fois que je dormais, tout mouillé dans la nuit là, tout mouillé, puis Marie me lève, me souke, me dit, me relève, changer radio. Moi, tout mouillé, me toujours suer, m'a transpiré le soir, même pas de connaître si c'est symptôme ménopause, mais on t'a pas le faire. Et puis, quand y a moi, et puis, m'te connais règle moi chaque mois, quand y a règle moi gonna venir chaque 4 mois, chaque 6 mois. Bon, quand y a presque le mal à l'hôpital, docteur m'a dit, qui l'autre règle moi, me dit, bon, pas même qu'à connaître, parce que les venir, il pas, presque pas règle moi encore. Et puis, pour affaire de l'âge là, gen les ménopause là, pas gon l'âge fixe pour un monde faire parce que m'gon soeur qui fait ménopause li à 32 ans. Depuis le fin fait deuxième puis il pas jamais réglé encore. Gen moun qui fait ménopause yo bonheur, gen moun tout qui fait li vraiment tard, gen moun qui 60 ans qui peut quand même gen konon moun mwen à 60 ans, 60 combien de temps il fait ménopause li. Gen les pas gon l'âge vraiment. Yo pas ka dire à quel âge on monde ka fait ménopause yo. Merci un peu pour ce sujet.
Merci, Serette, merci. Euh, then again, m'baka wè non encore, qui gen si gen men levé, si gen,
Stop sharing the screen and then we will see
Okay.
ok, alright, ok, apparemment non, m'pa wè
that.
non.
Même là, là, oui.
Ok,
Même, de lever même.
ok, go ahead, oh yeah, go ahead.
Ok, merci. M'ta fait suite avec question que t'es posée, hein. Et réponse, Monique l'a dit que dans la trentaine, etc. Donc, ça fait me poser des questions, c'est parce que gagne monde qui dans trentaine qui recevoir information ça qui ont senti offensé parce que valait de monopole qualité bonheur ça etc. Ça couvre bien et puis dans la présentation il y a un pré, il y a une période là et puis il y a un post. So, moi-même moi connais un monde qui était avec nous en Haïti. Il est dans vraiment early trentaine ou bien peut-être non, on peut pas dire notre petit nous-mêmes, il était dans la ensemble avec nous, mais il était vraiment jeune, et puis même dès qu'il était grand seul, Simon, il dit, il pas jamais regardé encore, il pas jamais regardé encore. Et puis, comme si j'ai trouvé ça drôle, vous comprenez? Mais sou gen, c'est de connaissance lo gen yo, li edo à comprendre ce qui passe dans le corps, ou bien à chercher information, ou bien parler avec le docteur, parce que nous connaissons que quelque chose qui a un rapport avec la partie génitale monde, c'est privé, même ma docteur ne va pas parler parfois, etc. Tandis que bien, c'est le bagage nous t'a supposé connaître, connaissance c'est richesse, donc ça permet que, ou qui attitude pour gagner, regarder les gens d'informations qu'on partage. Donc, je pense que le plus tôt, c'est le mieux. Tout autant qu'aux jeunes, connaissance, ça va pas dire parce qu'il y a connaissance, ça va dire, mais ne peut pas le faire. Mais au moins, ils mettez moins knowledge, enough knowledge to know what to expect. And then maybe I can talk to my friends and, you know, to my providers without having, being ashamed doing this, having this kind of conversation.
Ok, merci Perrette. Moi, gen, une question que je voulais poser. Janikah, vous parlez de la loi tout à l'heure là. M'pa konnen sou te ka ban un petit plus lumière sur ça. Comment on monde te ka utiliser la loi pour te ka aider le processus ménopause? Si vous connaissez, comment te ka utiliser les?
And that's aloe.
La loi, alors, yes.
I'm gonna go share the screen again. So there are two ways to use aloe. So the aloe can be used. The symptom that I mentioned that it helps treat is the vaginal atrophy, the dryness of the vagina. the pain, the discomfort.
Mm.
It can help with that. So you can use it two ways. You can use it vaginally. You can take the aloe, you can cut it up just like in this picture, and you can just use it vaginally to help with discomfort. You can use it as lubrication during sex. You can use it just for discomfort if you're just there and you're like, you need cool relief. It helps with that. And you can also take it orally because it helps with just orally, it helps with hydration, which the idea is the hydration eventually goes to the vaginal tissues.
Thank you. Thank you. Any other questions? Just a reminder, nous pratiquement là jusqu'à 8 heures, nous avons environ 13 minutes qui étaient. Si il y a l'autre qui a une question, c'est le moment pour nous poser au connaître. Oh, l'État semblé Janikah font un travail phénoménal parce que tout le monde clair, pas de question du tout. Oh non, Claire. Go ahead. Claire Marie?
Allô?
Yes.
Oui, bonsoir.
Bonsoir.
Je pas parler trop fort, c'est le travail moyen. Je dis merci pour exposer à Janikah et merci pour faire votre travail. Et qu'est-ce que nous pensons pour si on fait ménopause? Il n'y a jamais de symptômes du tout, du tout. Par exemple, moi-même, c'est seulement transpiration qu'on gagne le soir. Je dis pour qui me dit merci en pile parce que je toujours levé, je changer chemise de nuit. Après ça, je n'ai senti rien, je me dis chaud. Tout ça nous dit là, on va rien du tout, du tout. Est-ce que son bagage qui boli ou bien c'est un mauvais bagage? Et puis ensuite, tu parlé de petits moun qui fait ménopause, qui fait petite là. Est-ce que si on ne pas jamais fait petite du tout, et puis il est dans ménopause, et puis il vient enceinte, est-ce que son bon petit là fait, ou bien est-ce que petit là pas bon? Est-ce que ça t'a conseillé un monde comme ça? Que c'est dans ménopause, il réussit vient enceinte. Ok, merci, bye bye. Bye bye. C'est le travail, moi.
Merci Claire Marie.
Okay, I'm gonna need help with translating to answer that one.
Okay.
So there was a couple questions. The last one I remember was if someone goes in their entire life without being pregnant, and then if they can get pregnant with menopause, and if they did, would that be like a viable pregnancy?
Of the child, yeah.
Yes. Well, so if you have a kid or do not have a kid your entire life, it shouldn't affect menopause. You will have menopause regardless of if you were pregnant or if you were not pregnant. And anytime after menopause, which again was that 12-month period of not having a menstrual period, you cannot have a kid after that because that means your body's telling you, wrap it up, I'm done. The eggs are done. There's no going back. That's why they use the 12-month mark because if you're 3 months, if you haven't had your period for 3 months or maybe 6 months, there's a chance an egg still might come. You just don't know. But once you get that 12-month mark, there's no more eggs that are coming. So that means even if the sperm enters the vagina, there's no egg that's going to meet it and there's no pregnancy that's going to happen. But say there is a chance of somebody does, and there's nothing that is impossible. Say there's a chance where someone does get pregnant around the menopause time, they do have increased risk for a lot of complications. So it's increased risk for like premature, for miscarriage. It's increased risk for premature birth. It's increased risk for complications with the baby, but it doesn't mean it's not possible. It is still possible to have a safe and healthy pregnancy, but you would be a high risk pregnancy. So that's one question to answer, and then I don't know if you want to translate that into the next one.
Claire Marie ou Claire pour répondre ça?
Oui, ok.
Okay.
Et première question, c'était un rapport. She has not have any other symptoms, but had flashes. Is it normal? What do you think of that?
Yeah, that it's absolutely normal. Some people do not have any menopause symptoms at all. Some people may just have one, and some people may have all of them. Yeah, so it's absolutely still normal. It's normal. There's nothing wrong with if you have one or all. It's just everybody's body reacts differently. Everybody has different hormone levels in their body that are causing different symptoms. And well, again, more likely the symptoms your mom had are more likely going to be the symptoms you had too.
Ensuite, m'ta demandé pour la loi, est-ce que si on moun pou konan ménopause après le fin gen règle, est-ce qu'il ka servi à la loi? Moi-même toujours fait. Est-ce qu'il ka fait la loi et vaginalement si après règle parce que des fois moi me considère le temps que me prend le temps que c'est antibiotique. Est-ce que si une jeune fille qu'on guérit et puis il fait mal après règle là, il ka fait la loi?
Yeah. Yeah. Absolutely. Yeah. Another thing you can do if you feel like you need a second cleanse or flush or to rebalance after your period, you can also take probiotics. It's available over the counter, probiotics. It helps restore your vaginal levels, the balance.
Merci beaucoup.
Ok, nous, elle a avancé, nous pratiquement arrêté 7 minutes pour nous qu'à finir. Janikah, I just want to say thank you. Thank you to you. And in the beginning, as I said it, you are so young, but so concerned about us. And that makes me feel good that young people think of us and your knowledge. And it was clear, very clear presentation. I think everybody understand, excepté peut-être moun qui, mon interprète là, qui va faire un très, très bon travail parce que c'est de thèmes techniques que je ne connais pas, but it was clear, and we say thank you to you. And please, if we need your services in the future, be available because we can always use that. I don't know if Period has some announcements to make. But besides that, Janikah, it was a job well done. We appreciate you. We appreciate your knowledge. And may God continue to bless your life and your endeavors, in everything that your work, and that may you flourish beyond what you expect. Thank you.
Thank you so much, guys.
We have Rose. Nous gen la main de Rose. Rose qui levée. Rose, go ahead.
Oui, sorry, excusez, m'a dit merci Gertrude et m'a dit merci à Janikah tout. Question nan li short li pa long, c'est juste moi de ta besoin demander est-ce que les moun nan période ménopause ou bien déjà dans ménopause like 12 months don't have anything, est-ce que comme s'il a toujours senti symptômes like l'el kon gen période li yo, est-ce qu'il a senti ça dans breast li la qui senti kon gen peine abdominale ou sometimes il senti some symptômes dans breast li, est-ce que ça toujours en effet?
Mm-hmm. For the cramping, yeah, it should go away. You shouldn't have cramping because the only reason we have cramping is because our uterus is to get the egg out of the tubes and to help your period flow. If you're not having a period, you shouldn't be cramping anymore. So it should go away. And then the breast tenderness, that might stay because that's also one of the symptoms of menopause that some people say that they experience. So, and just all the symptoms of menopause, truly, some women say it never goes away for them. Just to also another thing, some people it lasts forever. So that's another reason why I think this is an important conversation.
Thank you. Thank you. Alors, Pierrette, tu as...
Merci Astrid. Merci encore Janikah. Non, vraiment content. Je ne sais pas l'autre mot pour me dire non parce que interprète nous te gagne aujourd'hui. Il est bien tombé parce qu'il fait ça. Donc c'est il est bien tombé et il fait travail là très bien. Nous contents, nous disons merci à Astrid aussi et à tout le monde qui était présent pour et puis qui participait tout. Je connais que quel que soit le monde qui l'a même là il pas posé question. Information yo recevoir là les très important et il y a un pile là d'ailleurs qui prend note ça quand même prend note on connaît gain là un pile là d'ailleurs qui prend note. Donc on remercie tout le monde qui a fait déplacement pour capable venir même si c'est virtuel nous. Donc nous dit Janikah on chapeau bas. c'est à bas. Alors, Janikah, on connaît n'a pas l'école avec vous quand même, on connaît, on comprend.
Yes. Thank you.
Yeah,
Thank you,
you
guys.
did an amazing job and we really appreciate it. Nous on connaît que le programme n'a fini comme ça, nous connaissons des secondes derniers bagages au midi. Donc, c'est le moment où vous êtes capable de dire, dernier bagage avant que nous nous séparions, et avec une prière finale. Mais second bagage au midi, si dans toutes sortes de là, si on bagage pour ne pas oublier qui ça t'a dit.
And this is, well, before I answer, I just want to say thank you guys so much for having me. Thank you so much. I'm really happy that I got to share a bit of what I know, what I'm studying with you, even though I'm still early in my journey of medicine. And I wanted to say special thank you for for pushing me, inviting me to do this, because it wasn't something I would have thought to do. And then thank you so much, Astrid, for your translation. It was phenomenal. Um, and then the answer, pretty much your question is like, what's the biggest takeaway I want to give for people to have from this? The biggest thing I want you to walk away with is knowing that you're not alone with your symptoms. You're not crazy with your symptoms. It's not taboo. Um, and that there's so many options that you can try. It doesn't have to be medicine. It doesn't have to be um, something prescription, but there's things at home that we can do. It. The reason why I want to say that is a lot of medicine, Western medicine in the U.S., it's a lot of pills, medicine, drugs. But there are things that you were doing in Haiti that you learned about in Haiti that were true. It's real. If you take codfish oil, it helps. If you use aloe, it helps. But medicine in the U.S., they don't focus on that. They don't research that. So I wanted to just you guys to remember there's natural options that you can try and see if it helps. And if it doesn't help, of course, there's more. And then another takeaway is just, again, you have a community of women who are here with you experiencing this many different levels. So we're just here. So.
Thank you.
Merci. Et nous voulons reconnaître la maman de Janikah qui est là ensemble avec nous, c'est la vice-présidente de Tabitha, c'est Monique. So, Janikah Brice, c'est la fille de Monique Balthazar qui est vice-présidente de Tabitha. Merci, merci.